Dr. Epstein with my patient who has pretty pronounced frontal temporal recessions. He also has a recession of his frontal hairline. He's got the thinning in here. And you can also see his temporal points, which this area is still quite well defined, although it's starting to thin out, especially on this left side. He's also receding all throughout here. His goal is to have a more youthful placed hairline, and there's two ways to approach patients like this. One way is to sort of come across and then wrap around like that. The other way is, which is the way I like to do it, is to first establish where the new temporal points, the new temporal line is going to be, then establish the hairline, and then what we can do is sort of transition from the frontal hairline to the temporal area. And so you see what I've been able to create for him. He hasn't seen it yet, so I'm going to show him, and hopefully it'll meet his approval. He knows a lot about hair, so it's I have some extra challenges. And you can see I'm trying to lower it as much as possible. He's got a little bit of a challenging case in that he's got a very prominent forehead, but yet this is not that. This doesn't. He's got a very prominent horizontal aspect. So attempts while I'm profiled to give him a nice straight look on the front view gives him somewhat of a receded look. So I'm trying to play around with that and trying to create as low appearance as possible. I'm going to go ahead and show him what I've drawn for him. Let me show you what I'm talking about. See all this area? I'm going to go ahead and bring forward. And I think if we can do that for you and then round this area off, I think that'll make a huge difference. Let's take a look in the mirror, because I also find looking in the mirror makes a big difference. Chin down just a little bit, because I can see it from the patient's perspective. And for example, I thought that this was in the midline, but in reality his midline is off a little bit over here. But you also see he's got, with his hairline, with his widow's peak, it's actually, he sort of has a natural widow's peak here, and the angle of the hairs are growing in this direction. Well, I'm going to do the same thing. When I make his recipient sites, I'm going to create a widow's peak. So it's going to be a little off to the right side, and the hairs are going to actually grow towards that right side. So these hairs are going to, basically going to follow his natural direction of growth. So here the hairs are going to grow straight down. Then here the hairs grow more in a forward direction, and then here's where the transition is. So the goal is to try to bring him forward just about this much, and I can do that because he's got a great donor supply, and he's also the kind of patient says, do whatever you can do to give me the the very lowest, the most youthful look. And that'll make a huge difference for you. You like that?
Totally.
All right. We're going to get to you in a minute, Sandra.
Oh my God.
Anyway, so that's what we're going to do. So we're all pretty much set, so you can go ahead.